Morning, everyone. Thank you for joining us for the Medical Board of California quarterly board meeting. While this meeting is being conducted with all participating board members and staff at the Sacramento meeting location, this meeting is being streamed interactively using WebEx to allow for remote public comment in the same manner as recent meetings. Public comments will be heard for each agenda item for individuals wishing to comment in person and remotely. To be ready for remote public comment, we ask that you please ensure your comments can be heard clearly by being connected to the audio of this meeting through the proper method. If you're having difficulty hearing the audio of this meeting, it could be because the device you are connecting with has bandwidth limitations. If you do have difficulty hearing the audio of this meeting using your device, please click the ellipsis button at the bottom of the WebEx application or the audio and video menu item at the top of the WebEx application, and then select Switch Audio. You'll see an option to call in, and then we'll be provided with a telephone number, access code, and attendee ID that you can use to connect to the meeting audio via phone. Using the information provided, it will automatically disconnect your device's audio and connect your phone to the name you joined the meeting with. By using this method, if you're having audio problems with your device, this will allow you to still participate and hear the audio of the board meeting. Please see View Additional Meeting Information link on the first page of the meeting agenda for more information on connecting to the meeting and accessing meeting materials. Thank you. President Hawkins, you can now start the meeting.
Thank you. Good morning. I'm very pleased and proud to be before you as the President of the Medical Board of California. Thank you for your vote of confidence and support as we continue forward and execute the mission of our board. I want to ask all of us to please turn your mobile devices to silent. You may notice board members accessing their laptops, phones, or other devices during the meeting. They're using the devices to access board meeting materials that are in electronic format. If you're a member of the media and require assistance or information, please see Alexandra Shembra. Ms. Shembra, please identify yourself. Thank you. This is an official business meeting of the Medical Board of California, and its disruptions of the board's business will not be tolerated. Government Code Section 11126.5 allows the board to remove people who willfully interrupt a meeting and to clear the room if order cannot be restored by removing or muting the disruptive people. We have a designated time on the agenda for public comment and items not on the agenda, and we'll ask for public comment on agenda items. The board welcomes public comment on any item on the agenda, and it's the board's intent to ask for public comment prior to the board taking action on any agenda item. For some reason, I forget to ask for public comment on an agenda item and you wish to speak, please raise your hand or come forward and you'll be recognized. This meeting is also being streamed via WebEx. Individuals attending the meeting remotely via WebEx will have an opportunity to provide public comment and will be assisted by the host who will be facilitating the WebEx meeting. During each agenda item, the host moderating the WebEx event will activate the raise hand and Q&A feature of WebEx. And we'll ask everyone wishing to make a public comment indicate so by raising their hands or entering yes in the Q&A window. The host will then call on the individuals who indicated they wish to make public comment by the name provided by the individual, which may be a pseudonym. When called upon, the host will unmute the microphone of the individual, and they will have 3 minutes to make their public comment. But this time period may be reduced depending on the number of people who wish to speak, so that more people may be heard. The host will audibly announce when 30 seconds remain to conclude the public comment. After the individual's time for public comment has lapsed, the individual will be placed back on mute. Only one public comment per agenda item is allowed per attendee. During agenda item 2, public comment items not on the agenda, the board has limited the total public comment period for individuals to 40 minutes. Therefore, after 40 minutes, no further comments will be accepted. During public comment on any other agenda item, 20 minutes will be allowed for the public comment period. After 20 minutes, no further comments will be accepted. Each person will be limited to 3 minutes per agenda item. I want to remind all speakers to please stay on topic and keep your comments to the allotted time or less. Today's meeting will be run according to the Open Meeting Act as required by law. We plan to end today by 5 p.m. I'd like to call the meeting to order. Ms. Taylor, please call the roll.
Dr. Bullock? Here. Mr. Brooks?
Here.
Dr. Helzer?
Here.
Ms. Jung? Ms. Lawson? Here. Mr. Lee? Ms. Lubiano?
Here.
Dr. Mahmood?
Yes.
Dr. Thorpe? Dr. Sai?
Here.
Mr. Watkins?
Yep.
Dr. Hawkins.
Here. Thank you. A quorum is present. I'd like to remind the members again that we will be taking a roll call vote on all action items. Moving to agenda item 2, public comment on items not on the agenda. Before I ask for public comment, I would ask individuals making comments to not discuss pending complaints, pending licensing applications, or pending disciplinary actions that may come before the board for a decision. Such disciplinary actions that may come before the board for a decision. Such decisions are considered ex parte communications, as they could provide information to the members that is outside the record in violation of the Administrative Procedure Act. Therefore, such discussions could create a conflict and lead to board decisions being challenged in Superior Court. The board can receive comments regarding the board's processes in general, but it cannot receive comments on specific case circumstances where the decision is still pending. In addition, the board would like the public to address the board as a whole and not individual members. Please be aware that public comments during this agenda item should provide information to the board members and is not a discussion between the board members and the public. The only action board members can take is to listen to the comment, decide whether they would want a future agenda item on that topic. No other action can be taken on the item at this meeting. So this may seem at times like the board members are not being responsive. Following guidelines is critical to ensure the rules of the Open Meeting Act and avoid compromising the speaker's goal or the board's mission. If you want to comment on an agenda item, please wait until we get to that agenda item. Comment at this time are only for items not on the agenda. Please limit your comments to 3 minutes. First, are there any public comments from those present in the hearing room? If so, please come forward. Please introduce yourself.
Good morning. I'm Rosanna Davis. I'm a licensed midwife, and I'm president of the California Association of Licensed Midwives. As we know, the legislature declined to take up the medical board's recommendation to sunrise a licensed midwife board, which would be the first step in addressing regulatory problems that have plagued the licensed midwife program since the medical board was tasked with overseeing it in 1993. The CDC's latest statistics show that the demand for midwifery care in out-of-hospital settings has increased 35% overall during the last 5 years, with increased demand for midwives being even stronger among Black and Hispanic women, who are disproportionately affected by the growing maternity care crisis in California and throughout the U.S. We can no longer afford to be saddled with an arcane regulatory process for midwives built on inherent conflict of interest that inevitably focuses on eliminating the ability of midwives to practice in California than it does on promoting public health and access and safety and the full spectrum of midwifery care. I would like to ask the board to reconsider the proposal and invitation I extended in my letter dated August 2022 to work together with midwifery stakeholders to identify an interim and stopgap measure that would be short of a midwifery board. An obvious first step is a licensing midwife disciplinary committee under the medical board. But we look forward to finding more and better solutions for Californians who are in urgent need of forward-thinking approaches to expanding access to maternity care in our state. Thank you.
Thank you. Next person, please come forward.
Hello, my name is Heidi Marshall. I'm a licensed midwife in California. I've been practicing for over 20 years in a variety of settings, including I own and am the clinical director of an accredited birth center up in Mendocino County. I'm here today to express my deep concern about the flawed process, the medical board's review of complaints against midwives. Currently, we are primarily being reviewed by experts not in our field. This directly goes against statutes and the legislation that state we must be reviewed by those who have an expertise and knowledge in our field. If the medical board refuses to follow its own rules and guidelines, then the most workable solution is that licensed midwives has a board of its own. This board would be reviewed by experts in our field, and they would regulate us and be the decision makers on actions that are either rehabilitative or punitive when appropriate. Thank you.
Thank you.
Hi, I'm Ariel Jackson, and I'm speaking to you today as a lawyer with a background in medicine, but also as a mom of 4 young children who were delivered outside of a hospital with licensed midwives. When planning my family, I did extensive research, and I was deeply concerned by maternal mortality rates in the US and even in California. When I found my midwives, they openly shared all of their statistics on transfers, interventions, and outcomes, and very clearly walked me through all of the risks and benefits of midwifery care. Throughout all 4 pregnancies and births, I received the most incredible, thorough, and evidence-based care. The California Medical Board's stated goal is to protect healthcare consumers and prevent harm through proper licensing and regulation. As a healthcare consumer, I assume that the medical board took all complaints against physicians and midwives seriously, and that they were reviewed by fellow experts in their field. Imagine my horror when I found that less than 10% of physician complaints make it to full investigation, but nearly 100% of complaints against midwives go to full investigation. Midwives are in a profession that is already incredibly demanding, but also doesn't pay well, less than half of what first-year physicians generally make. I also found out that rather than having midwives reviewed by fellow licensed midwives, midwives under investigation are routinely reviewed by physicians totally outside their practice areas. And the medical board also shops around for experts until they get the outcome and associated costs that they want, which are borne by midwives, and is something they do not do with physicians. Midwives under investigation bear all of these costs of the extensive investigations, which often go on for years, unless they choose to give up their licenses. These experts, who know nothing about midwifery, are also reviewing based on underground, unpromulgated regulations, which again goes against the medical board's own standards. There seem to be no checks on the medical board blatantly targeting midwives with a pattern of outrageous financial penalties rather than recommending rehabilitative measures to ensure that patients receive quality care. And we're here to put the board on notice that we as consumers are aware of this behavior. And we demand that the medical board follow its own guidelines and make a clear and honest effort to appropriately regulate midwives rather than just define them out of existence. Thank you.
Thank you.
Good morning. My name is Jackie Jorgensen. I birthed my only child at home under the skilled supervision of licensed midwives with the blessing of my OBGYN and primary care physician. And I want to make this really clear because I have some big feelings about this. I'm not anti-doctor. I count y'all among my heroes. You've saved my mom's life more times than we can count. And I thank you for the value and the service that you bring to our society. And I hope you really hear me on that. But I want to recap what I'm hearing here because it's extremely concerning. Almost 100% of complaints against midwives go to investigation, compared to 4 to 7% of complaints against physicians. Within the review process, the California Medical Board routinely shops around experts until they find one who sides with them against midwives. This is a common practice, and it's all happening at an exorbitant financial cost to the midwives. Probation under the California Medical Board is a punitive pay-to-play model costing midwives tens of thousands of dollars instead of delivering true rehabilitative support as it's meant to. I want to know how the medical board can explain these actions. What is your end goal here? Help me understand. Is the medical board trying to extract as much money as possible from licensed midwives for itself? It's not a great look given the current state of the board's finances. I don't want to believe that. And I'm really hoping that's not the case. I think you know that these midwives are not your cash cow, right? So let's consider the other option, which is that the board is trying to wipe the very existence of midwives off the California map altogether. You don't have the legislative power to eliminate them outright, but you don't need it because your actions are backing licensed midwives into a corner and finding them out of practice. This is especially egregious given the severe financial penalties have no place in an industry in which its practitioners receive so little income to begin with. So which is it? What's clear to me is that the medical board, in its unfair and perhaps even corrupt treatments of licensed midwives, is not fulfilling its state-given authority to preserve high-quality patient care or choice. Midwifery is a choice, and it's a valid one that many birthing people value, and you have no right to take it from us. Your attempts to do so are an abuse of your power, and they are causing profound harm to not only midwives, but the birthing people of California. And the key word here is choice. Doctors, again, I believe that you are a blessing and we need you. Thank God for you. But we need our midwives too. And I will stand and I will fight with them for their right to exist and to receive just oversight from a board of their peers. I urge you, for the good of all birthing people across the state, to work together amongst yourselves and with these midwives to come up with a suitable solution. Thank you so much for your time.
I think that's the last person in the room. Thanks for your comments. Any public comments on the WebEx?
For anyone wishing to make a public comment online, you can either use the hand raising function or just type anything in the Q&A window and we'll call upon you in the order that we see you. First up here, we have Marianne Hollingsworth. Marianne, I'm sending you that request now.
Okay, can you hear me?
We can, Marianne. Please go ahead.
Thank you. Good morning. My name is Marian Hollingsworth, and I'm a patient safety advocate. I'd like to talk about another patient advocate today. Most of you recognize her name as a regular caller at medical board meetings. She was Sasha Lauren. I use the past tense because Sasha passed a few days after your last meeting. Some of you may have heard of her passing, but you may not know that it was by her own hand. Instead of shrugging off her death, all of you on the medical board should really think of what led Sasha to think suicide was her only option. Sasha was a victim of medical harm, deliberate medical harm, which left her once strong body disabled. It's important for you to know that every single state agency Sasha went to for help or accountability failed her. The judicial system, this medical board, and all the state systems to help people with disabilities. Sasha was left with a pittance to live on, and when her elderly mother passed in August, Sasha lost a place to live. Not wanting to burden others with her plight, she quietly took her own life. The medical examiner's report listed a very cold and factual cause of death: suffocation. It was heartbreaking to me that she died that way. So you are probably all thinking, well, this is sad, but it's not my problem. But it is your problem. It does involve all of you because this board can do better. Sasha looked up the doctor who harmed her, and he had a clear profile on your website. He looked safe because the board said he was. When she was harmed and filed a complaint against this doctor, you tossed it out. There wasn't even a full investigation. This doctor's profile is still clear, putting future patients at risk. What alarms me now is that this board now has a disclaimer on its website warning people that their doctor information is not to be relied on because it's not guaranteed to be current, timely, or even accurate. After years of telling us to look up our doctors, you now have the audacity to say your website is not necessarily accurate. You must do better as a state agency. We consumers rely on you to give us accurate information on our doctors so we can make self-health care decisions. There will be more harmed patients like Sasha if you don't dedicate yourselves to doing a better job of protecting patients by keeping your information as current as possible and then listening to consumers when they turn to you with a complaint. Sasha is a symbol of the failure of the medical board to protect patients. Please honor her memory by vowing to do better with your investigations and your information. Thank you.
Thank you for your public comment.
Thank you.
Next up here, we have Rosie Arthur's daughter. Rosie, you should be receiving that request. Rosie, if you're there, you should be receiving a prompt on your end to unmute. There you go, Rosie. Looks like your line's open.
Hello?
Good morning, Rosie. We can hear you.
Oh, okay, good. I agree with the last presenter. This is happening not only when a complaint is not aggressively or appropriately facilitated, but when the various guidelines and such are not wholeheartedly endorsed or facilitated. Thousands of people kill themselves when they run out of options. That is true. And when one looks at the whole design of things, it does appear that there maybe is some benefit to society by that happening, and certainly to the insurance companies. But be that as it may, we spent years now, since at least 2013 till recently, revising the controlled substances guidelines. Now, while that's talking about one class of drugs, it actually involves any type of prescription medication, because the prohibitions and cautions there apply across the board, which mean anytime you go to see a doctor and they've not prescribed a medicine for you before, not prescribed for you before, etc., they're going to find some way not to prescribe you any kind of medication, least of all a controlled substance. Whether it's the safest thing to take, the best thing to take, in your interest, what's in their interest is keeping their license, not getting sued. What's in the insurance company's interest is not getting sued. The patient, we call this the Department of Consumer Affairs. It should be anti-consumer affairs. So now we have a new guideline out and nobody in the field is acknowledging it. You haven't promoted it. Not one bit. All the time was spent was just to listen to us. Not hear us, well, maybe hear us, but not actually act on the concerns in a way that goes beyond some paper that nobody's ever going to read. Now we have the DEA guidelines that everybody has to
30
address.
seconds remain.
And these are done with a 8-hour free internet course that doesn't teach anybody anything about prescribing medications, only about how to avoid litigation, keeping good with your panel, etc. We need to have a meeting to look at the impact and find some way to facilitate good practices, best practices, and actually help the consumer and their care providers. We need to have something that works, and just having one after another free course that's promoting somebody else's best interest doesn't help the consumer. Thank you.
Thank you for your public comment. I don't see any additional requests in queue at this moment, but I do see a call-in user I neglected to mention earlier. You can press *3 to raise your hand. Anyone else wishing to make a public comment, you can also raise your hand or type anything in that Q&A box and we'll call upon you. I now see Michelle Montserrat Ramos. Michelle, you should be receiving that request. Morning, Michelle. Looks like your line's open.
I am Michelle Montserrat Ramos, and I am with Consumer Watchdog. We would like to know if there is an attendance policy in place for appointed board members. We have been waiting to meet our new public board member, but we have not had the opportunity to do so because he has not attended the last 2 or possible 3 meetings as of yet. If we have an attendance policy, can you please inform us at the next board meeting? We have important work to do in the coming year, and we would like to meet our new public board member and know that he is engaged in the board's work. I would also like to echo the sentiments about the loss of Sasha Lauren. It broke my heart to hear of her passing at her own hands. This board let her down. I work with many families, and there have been other occasions where there have been close calls with other advocate families. Thankfully, we have developed a team, and I've personally intervened. They are still here. We talk about physician burnout, physician suicide, but we do not acknowledge the extreme grief and the stress that is placed on these families with enduring their loved ones' deaths and then having to face no accountability by this board. I think we can all learn from Sasha's untimely death. We need to, not just in Sasha's memory, but on behalf of all Californians that face this board. Thank you.
Thank you for your public comment. At this time, Dr. Hawkins, there's no additional requests in queue.
Thank you very much. Moving on to agenda item 3, approval of minutes from the August 24th to 25th, 2023 quarterly board meeting. Members, are there any additions or corrections to the August 24th, 25th, 2023 board meeting minutes?
Just a housekeeping issue. My name is misspelled, just so you guys can correct it. And that's my only amendment.
Thank you. Under agenda item number 5, board member communication should, I'm sorry, correction. Where is this at?
Do I have to move to approve the minutes?
There's actually a place to another correction. Page 3. Mr. Vardy stated the board should party meetings to discuss the complaint tracking system on June 21st. It says 2021. The corrected date is June 21st, 2023. Yes, Mr. Watkins.
Yeah, I just want to comment, we're back to a narrative, and the previous minutes, we just had like a date stamp and then you just listen to the recording. And I think that is more, more accurate, just for consistency. Because I had to find myself reading it and then listening to it, and I thought, why don't I just listen to it?
Yeah, so the recording of the minutes occurred because there was a comments that folks felt they were not adequately represented, their comments aren't being adequately represented. So we figured if they're recorded and you have a specific interest, there's an opportunity to actually hear what was actually stated. Thank you. Any comments from the public in the hearing room about the minutes? WebEx. I have a motion to approve the August 24th, 25th, 2023 board minutes.
Sorry, Dr. Hawkins, we do have a hand here on the WebEx. Rosie Arthur's not sending you that request here. Anyone else wishing to make a public comment on this agenda item, you can type anything in that Q&A box or use your hand raising feature. Press *3 if you're on a phone only connection. Morning, Rosie. It looks like your line's open.
Okay, thank you. I wanted to comment on the minutes at item 7 regarding the DEI issue and the admonition that was given by the presenter there that you should not deal with certain states who have legislation that was designed to protect women and children. We don't need to go into all the details of that. And it turns out that the advice given to you regarding the fact that you could not communicate or travel to or whatever, and this would prevent you from doing your enforcement work, or could be construed to be such. Here's the problem. What she didn't tell you was that she only addressed the first part of the legislation, which is typically what happens in these meetings. The second part of the statute addresses your board's enforcement activities, which are allowed. So if there are any of these mass number of rejected complaints that were rejected in any way, shape, or form due to the fact that you might have to communicate with a state that had different laws than you to protect their consumers, then that would keep people here from having a complaint appropriately processed. If there's
Excuse me,
even one of
Officer's
those,
daughter, is this
yes.
a correction on the minutes?
Well, it's regarding that the fact that this person here, Ms. Gear, failed to tell you that your business, your enforcement business was not affected by this legislation. She made it sound like you couldn't travel to or communicate with people from certain states, and it's 26 states that it involves, so it's over half the country. So it seems like this should be corrected to include the entire statute that was referenced and to show that you were not given the information that your enforcement activities were not prohibited by that legislation. I think that's important to know, and that needs to be a part of the record, not giving you bad information. And
Thank you very much.
that's why I brought it in, because that's exactly what that does. Thank you.
May I have a motion to approve the August 24th, 25th, 2023 board
So
meeting
moved.
minutes as submitted? It's been moved in second. Please call the roll.
Dr. Bolat?
Yes.
Mr. Brooks? Dr. Helzer?
Yes.
Lawson? Ms. Lubiano?
Yes.
Dr. Mahmood?
Yes.
Dr. Sy?
Yes.
Mr. Watkins?
Yes.
Dr. Hawkins?
Yes. Moving on to agenda item 4, President's Report. It's been stated earlier, I'll repeat it. The mission of the Medical Board of California is to protect healthcare consumers and prevent harm through the proper licensing and regulation of physicians and surgeons and certain allied healthcare professionals, and through the vigorous objective enforcement of the Medical Practice Act, and to promote access to quality medical care through the board's licensing policy and regulatory function. I want to express my personal gratitude for the opportunity to be president of the board and to be of service. This board and staff will roll up our sleeves to do the work Californians need and deserve. We will accept invitations to work collaboratively with the advocates and the public. I want to mention a few noticeable accomplishments of the board and some of my priorities. Senate Bill 815, our sunset bill, was approved, and we're going to have a more discussion about this later today, but I want to highlight a few items. First, the fee increase that will help us perform our mission. Second, the online complaint tracking system, which we presented on Friday. Third, the complainant liaison unit. And fourth, complainant interview prior to closure of quality care cases. This board, and I want to personally thank Governor Newsom, DCA leadership, the legislature, and the consumer advocates. Special thanks and acknowledgement to President Lawson for her tireless work, often under extremely difficult circumstances. Thank you. This success with our board and bill would not have been possible without the staffs of the medical board. They're extremely dedicated, hardworking, and intelligent. I cannot overemphasize we would not be here without them. They understand the board's mission and put it above everything else. Consumer advocates continue to be of service to the California citizens. We will accept their offer to help us work collaboratively. The maternal mortality issues was the focus of our last quarterly board meeting in Bakersfield. We'll continue the dialogue and actions. I intend to participate in a guest observership with the California Pregnancy Associated Review Committee of the California Department of Public Health and report back at a future meeting goals including highlighting toolkits to improve outcomes. We have a strategic plan, which we prioritize. Comments have been made about the updated guidelines for prescribing controlled substances. I want to thank board members Brooks and Thorpe for their leadership and for stakeholders and other advocates that participate in updating for this update. It's my hope and expectation that patients who are appropriate for these treatments will receive them and physicians that prescribe them appropriately would not suffer undue discipline. I plan to resume some important standing committees, for example, the Enforcement Committee, and I plan to resume meetings that foster dialogue between the board staff, and the public. It's been stated earlier, Shasha, I knew her, Susan Lauren, a public advocate, has passed, and her suffering has ended. It was quite noticeable when she did not speak at 2 prior board meetings ago. Finally, I'm convinced an improved version of us all as community as possible and probable working together with mutual respect, accepting strengths and vulnerabilities for the greater good as an achievable outcome. This ends my report. Are there any questions or comments from the members on my report? Any comments from the public present in the room? Any comments on WebEx?
Anyone wishing to make a public comment on the WebEx can use the hand raising feature or type anything in the Q&A window and we'll call on you in order we see. Any call-in users that would like to make a public comment, you can press *3 in order to raise your hand that way as well. First up here, we have Rosie Arthur's-daughter. Rosie, you should be receiving that request on your end.
Yes, I did. Thank you very much. Thank you, President Hawkins, for acknowledging the controlled substances work, and I likewise thank the efforts of Doctors Brooks and Thorpe's in that regard, and do want to again ask that we continue this work. It was not complete. We knew that at that point in time, and so we need to start that ball rolling again, especially with the new requirements for DEA training that's in conflict with the guidelines and the spirit of the law, and certainly in conflict with the millions and millions of people who have to rely on prescribed medications of all sort to, ease their pain and suffering. And we need to try to move forward in a positive way, look for the problems, look for solutions, not simply respond to an edict and then forget it. That's what happens. And like Sasha, my son died as a result of being denied his medications, and when he complained, he was punished for complaining. And like Sasha, he took his life. And the coroners, they don't look for the actual cause of these. They just put it down to a mechanical thing, suffocation or whatever. Then they pass, nobody says anything, nobody does anything. I've been attending these meetings for over 10 years, and I've seen lots of words pass, but facilitating the goals and trying to help resolve the issues, there's a lot of work to go to, and it should not require a person to wait for years for that information to be available, that a doctor like Dr. Margaret Salmon lost her license, and she was allowed to treat people after she lost her license. After she lost her license, she was still treating people. Now, I couldn't mention her name before because there was something litigating still going on, but she's lost it now. How many people did she damage when they failed to tell you that she wasn't authorized to practice medicine? And there's no way to get that back. So we need to do things better, smarter, and look at best practices, not the best way to have deniability or to avoid litigation.
Conclude.
Thank you.
Thank you for your public comment. At this time, Dr. Hawkins, I don't see any additional requests.
Thank you, Ms. Dr. Daughters. Moving to agenda item number 5, board member communication with interested parties. Members? Dr. Mahmood?
Yeah, I was reached out by a couple of 3 doctors about some letter they got.
Microphone?
I was reached out by a couple of 3 doctors who got the letter from the board for something, but that's all the thing was. They reached out why this is and said contact the board. That's all.
Mr. Watkins?
Yeah, I've continued to talk to the patient advocates, but it was different this time because when I attended the last meeting and Sasha, whose real name is actually Susan, wasn't there, I reached out and our last conversation was quite interesting because she didn't see a way forward. And even in conversation, and I've spent hours talking to her over the last year. So I kind of had a feel for when she goes into a pain pattern and out of a pain pattern. But this time, everything looks clearer when you look back. I didn't see that, that it was at that level. And when I got the news, I can honestly say I was down for 2 days. I couldn't deal with it because of putting so much work. Her goal was just that nothing happened to her. That what happened to her, she never wanted to have that. So I have a request from the chair, whether we could have a moment of silence because she came before this board for, I don't know, as long as I've been here. Just out of respect, because she really felt that we never listened. And as part of making amends, rest in peace, I just, if it's appropriate, to just ask for a moment of silence, just for her.
Thank you very much, Mr. Watkins. I believe that I feel very comfortable. You could hear, unfortunately, the pain, which I know was more than physical pain, had to be emotional pain as well. I feel very comfortable saying, let's have a 60-second moment of silence and try to learn from what she tried to teach us. 60 seconds. Thank you for that offering, TJ. Additional comments? I continue to talk to medical students and residents about the very special gift they have, being able to provide care to citizens of California with the associated responsibility, and educate them about the mission of the medical board and the importance of listening to their patients. Moving on to agenda 5, board member communications with, oops, just did that. Sorry. Board member communication with interested parties. Oh, I'm sorry, as for, oh, thank you. I'm new at this. Public comments in the room related to presentation of interested parties. Anyone in the room? WebEx?
Anyone wishing to make a public comment can use the hand raising function or type anything into the Q&A box. If you're on a call-in-only line, you can press *3. Give everyone a few seconds here to queue up if interested. Okay, Dr. Hawkins, at this time I'm not seeing any requests.
Thanks, Steve, for allowing me to get back on track. Thank you again, TJ. Moving to agenda item 5, board member 6. Yeah, guess I'm not quite there yet, am I? Oh, boy. Randy, start over again. Executive Management Report. Agenda item 6.
Thank you, Dr. Hawkins. First of all, I wanted to say something off the script here that acknowledged Susan Lawrence's demise is pretty hard on staff as well. We did get the message and we did have some reflection on it. But at the same time, I just want to reflect for the board information that outside the board meeting, me personally and the staff had many meetings with Susan over the phone, hours long, and she did send us a lot of information for our review, and nothing's going to be going to the waste. We're still processing that, but we were really saddened by the news and unfortunate news, but just wanted to acknowledge that before I get into my report. So thank you. So good morning, members of the board and Mr. President and Vice President. I just want to start my report with the administrative updates. During the last quarter, the board staff had several meetings with Board President Dr. Randy Hawkins and Vice President Mr. Lori Lubiano, and to discuss many matters that are related to ongoing board projects and meeting minutes and meeting agendas, and future planning of board meetings for next year and as such. The board staff and also met with Gloria Castro, Senior Assistant Attorney General. We had frequent meetings with standing meetings, weekly and monthly meetings with HQIU staff to discuss progress of investigations. Board staff participated in meetings with other local and state national organizations in discussing and deciding regulatory measures. And also some of these organizations include Federation of State Medical Boards, Society of Cannabis Clinicians at UCLA, California Society of Addiction Medicine, San Diego, and the California Association of Medical Staff Services. So these meetings, to summarize, the topics include cures database, cures progress, and hospice fraud task force. And also notably, just this last quarter, we had many meetings with stakeholders on notice to consumers, which was part of Senate Bill 798, open payment database, AB 1278, and also revised guidelines for prescribing controlled substances for pain, etc. Moving on to staffing updates, I'm very happy to report that the board's current vacancy rate is down to 11.2% of vacancy rate, which was previously reported as 17.2%. And which, so this is a great achievement in this quarter that we were able to add 10 new employees between August 1 and October 31st of 2023. We continue to hire more and staff and retain more staff. So I'm hoping to bring this percentage vacancy rate down below 10% very soon. Speaking about staffing update at this time, I'd like to take this opportunity to acknowledge our new Deputy Executive Director, Ms. Marina O'Connor. Also, our new Executive Secretary, Angela Strother, is here with us too. This is her first meeting. So moving on to the budget update, we concluded FY 22-23 with 1.9 months of reserve and decreased its total expenditure and expenditure adjustment by $1.9 million from the previous year. The board took a $10 million loan, as you know, in 21-22, and again, another $8 million loan in FY 22-23. Both these loans are taken from a DCA special fund with 24-month repayment period, and the board received a fee increase, notable fee increase that will take effect January 1 of 2024. And this is part of the Senate Bill 815, which we'll have in-depth discussion during agenda item 8A. And the fund condition report that we will review here in a minute will show that we might have to take another loan this year because the fee increase is effective January 1, 2024. So this new loan, we don't know how much it is going to be or whether we need it next year or before the end of this fiscal year, will give us that cushion before the full impact of the fee increase hits us. So more on to that when we go over the fund condition report. Media relations and external communication update as listed there. I don't want to read each one of those lines. As you can see, we had many contact with the stakeholders and published reports like annual reports, published notices for proposed regulations, and also email distribution, vital information that was given to us by the California Department of Public Health, informing readers about the updated guidelines on screening for TB infection in adults from so that was sent out to all the physicians and others listed in our database, and also Senate Bill 143 to include other license and also other licensing process changes as listed below on page 6A2 was sent out to all the licensees. Moving on to remote working update, there's no new change this quarter. The percentages of employees working teleworking and also employees not teleworking pretty much the same as last fiscal year or last quarter report. Information system branch update, November update is that over 99,763 licenses have completed the survey, and on page 6A4 you can see a graphical interface that shows the progress of the survey. Complaint tracking system, the big long three paragraphs there is listing pretty much like the history of where we were from May of 2022 and to now. And so there will be a detailed presentation on online complaint tracking system as part of the agenda item 14 on tomorrow. But the goal of this agenda item presentation tomorrow would be to obtain approval from the board to continue with the stage 1 business analysis process with the set of minimum variable product requirements and initial release or for this initial release, so we can obtain formal approval from the California Department of Technology to proceed with project and develop the project plan, include a release schedule. So that will all be discussed tomorrow as part of agenda item 14. Printing your wallet card project is still continue to have more adoption rate. And again, as reported before, this actually saves the board a lot of cost in printing and mailing expensive plastic cards. Direct online certification submission docs update. The numbers are listed on page 6A-6. At the top, you can see the increase in documents and that are uploaded and how many organizations are part of that project right now. Again, this is also saving more processing time for licensing staff. So we hope to see more and more organizations join to update their documents online, so help us with faster processing of licensing files. Online complaint form redesign, there is really no update to report at this time. The Department of Consumer Affairs project, PGC, approved funding, but due to resources being unavailable until January 2024, the project is placed on a backlog at this time. So there's really no new update for that. So moving on to page 6A8 with some graphs and charts to give you most up-to-date information about Attorney General's expenses versus budget of the last budget year. And I last meeting in August, I reported numbers, but those numbers were from fiscal month 12, but now that we have closed the fiscal year 22-23, there's not much of a difference here. What is notable is if you look at the bottom of that bar graph, you can see FY 22-23, the AG budget was $16.9 million, but we only spent 14.7 with a 2.149 million savings in the AG budget. It is notable because if you look back at the previous fiscal years as listed there, FY 18-19, we pretty much break even, but then the next 19-20, 20-21, 21-22, we spend more money than budgeted under AG, but this last fiscal year, we were able to save $2.149 million. I do not want to go in depth with each unless board members have questions, I can answer them. I just want to jump over to unscheduled cost recovery, which is on BRD 6A11. This shows last fiscal year, the total amount of cost recovery that was we were able to collect, $1.1 million. And the breakdown, you can see that we started back in July 2022 and to June of 2023. And you can see a monthly breakdown of that. Now, then I'm going to skip over to unscheduled cost recovery FY 23-24 fiscal year month 3, which is on BRD 6A 15, page 15. And this is this fiscal year, July, August, and September of this year. And if you're comparing this to FY 22-23, FY 22-23 was essentially the first year of cost recovery reinstated for the board. Therefore, the current year collections appear more, but it is following the trend that's been set. So we are at the same pace as compared to previous fiscal year. BRD, the next page there, 6A16, there's a correction in case anyone is still looking at the first set of numbers that were circulated, or I think it's been updated since then on the website too. The total budget listed on that page for Attorney General for enforcement activities, previously it was reported as $16.8 million, 16,871, but it's corrected to 16,861. In case anyone have the old copy, please make that correction. And so just wanted to note that correction there. Moving on to page number 6A 23, which is the fund analysis or fund condition report, as we call it. So this is our report that we review every time when we're looking at our progress that we are making. And as I reported before, the actual of 22-23, if you look at the leftmost column there at the very bottom, you can see months in reserve 1.9, as I reported before. And then current year 22-23, we started out with 12.6. And then as you can see, those red indicated numbers are reflective, are the fee increase amounts that we are anticipating to collect this year. So you can see the number there when you towards the middle of the page there, the $27 million. And that is what we anticipate to take another loan this fiscal year. But as I mentioned before, at this point, we do not know if we need that. We will carefully look at it, and based on the months in reserve projection, we might need all of it, or we might need some of it, or we might not need any of that. But that's something we have to keep an eye on. The next two items listed, 10.160 and 8.230, those are the loans, the $18 million I was talking about before, I was mentioning before. That $18 million have to be repaid in 2 years, but we are hoping that we can pay both loans this year, even though that second $8 million is not due until next fiscal year. If we can pay that off early this year, we can save on interest. So that's our projection for this time. And so with all that adjustment, we are hoping to have a months in reserve of 2.2 at the end of this fiscal year. And you can see as we progress, and one notable thing to point out here, the $27 million if we need to take that or some of it. There is some discussion, and DCA is working on subsequent legislation and discussion with DCA. We know that negotiation is going to allow us to pay that loan in 10 installments going forward. And we don't know the details of all that yet, but again, tomorrow when we have an in-depth discussion on Senate Bill 815, we'll have someone from DCA budget here, and we can have an in-depth discussion on that at that time. That's all on the finance side of it, and I want to move on to the enforcement program summary on BRD 6B-1. So with the passing of Senate Bill 815, enforcement program is looking forward in adding additional staff to manage the new complaint liaison unit and to conduct interviews for quality of care complaints. Also, currently in the process of drafting a plan for implementing a new and improved collaborative working process with HQIU and AGO. Hope to finalize this draft by early 2024. Central Complaint Unit, the average number of days to initiate a complaint in the Central Complaint Unit is 6. Again, the previously circulated report had 4 days in it, but that's supposed to be 6. If you have the old copy, please correct that for the record. And the average days to complete processing of the complaint in CCU is 128 days. Also, CCU management is working with the other staff in ISB, in Information System Branch, in development of the new online complaint tracking system. And again, we'll have a presentation of that tomorrow as one of the agenda items. Discipline Coordination Unit, DCU, currently has 3 vacancies, but this is the unit that had most of the vacancies in enforcement, but I'm happy to, they are hiring more staff and retaining, and staffing in DCU is expected to be 100%. And it is important that we ensure that they are 100% staffed, because this will help with timely processing of disciplinary actions. Probation unit currently has 2 vacant inspector positions, one in Glendale and one in San Dimas. Complaint Investigation Office, these are the special investigators. They have a unit caseload of 265 cases. That breaks down to about 41 cases per investigator. Moving on to licensing updates. The first quarter of fiscal year 23-24, the board received 2,607 initial license applications. And again, the numbers, the breakdown of those application numbers are listed there. It is important to note that the board issued 60% more physician surgeon applications in Q1 than the previous quarter, and more than any other quarter over the last 3 years. It is an important information to note at this point. And also, effective January 1, 2024, the board will no longer accept certain application documents through the mail. These documents will only be accepted through the direct online submission system, which is the docs portal that we refer to. The licensing program continues to take steps to reduce the licensing application backlog, such as hiring 10 additional retired annuitants to assist with the setup and review of license applications. Other board unit staff also continue to assist the licensing department in reviewing and processing applications. And due to this effort, the backlog of setting up new application has been eliminated, and the licensing program is on track to eliminate the backlog in reviewing new applications. The webmaster report for Q1, we responded to 2,772 emails via licensing webmaster. And also on the consumer information unit, active call volume. This past quarter, we had 16,524 calls, and the average wait time was 5.08 minutes. The licensing application, and usually they call regarding asking questions about application status check, license application questions, complaint questions, request for mailed complaint forms, and inquiries regarding changes in licensing status. And the board also had 2 outreach presentations at accredited postgraduate training program orientation events. their licensing staff were able to answer questions and provide feedback. So to end my report with some more good news is that we only have 24 physician training license applications left to review, and most of these are received in November. As of last week, the processing time was still on a high side, but we project the timeline to be at 30 days by end of this week. And the physician surgeon application processing time will be down to 30 days review time by end of next week. President, that conclude my
Great.
prepared
Well,
remarks.
Thank you very
and I'm
much,
prepared to
Varghese,
answer any
very,
questions.
very much. It was significant, the savings we have with the Attorney General's office, particularly since I think their fee rates increased in the last couple of years. I don't know if you have any comments about that. but, Are there questions or comments from the members?
I do have a quick
Mr.
question.
Brooks?
Thank you for your report, and your staff is doing a fantastic job, and congratulations also on reducing the vacancy rates. That's a big deal for you, your staff, and our team moving forward. You had mentioned the time of calls around 5 minutes, and it sounds like most of these calls are dealing with application type of functions, right? Is there any way we can automate it online to reduce the number of calls so they can figure out what their problems are?
Yeah, that's a good question, Mr. Brooks. We constantly look at variety of things, especially for example, the message on hold. Sometimes, what are the messages given on hold while they're on hold? Sometimes their question is answered, so they don't have to wait for talking because, the message on hold will satisfy that. There's also a feature for callback. So they can, they don't have to be online. They can leave their number and the system will call them back. So yes, we constantly look at all that to see if we can reduce the timeline. But the 5 minutes, it is very long time. But this past couple of 3 quarters, as you can anticipate with the large volume of backlog and licensing applications, they're not satisfied with listening to the message on hold. They just want to talk to someone to get the status of their application, so they just hold on to it. But
I guess my question though is, can't we automate that? I should be able to go and look and say, here's my license, here's the status, here's what I'm missing. Please provide it.
That's already there. They can check the status of their applications online, and they can see the deficiencies. And but still, but the delay of the process is they will mail in they can see that they're missing this one form online, but so I FedExed that a couple of days ago, right? And I have a acknowledgement that the board received it. Well, just because we received it, it may not have updated. That's that processing time delay I was talking about. So there may be a large volume of documents that are received through mail and that are not reflecting in the system immediately because they're not uploading that online. So that creates a delay. But this is an area that we are constantly looking at streamlining going forward.
Great job.
Thank you.
I wonder what your last comment about the licensing, since our numbers are going down, we're playing catch up, where there'll be greater ability to focus on basically what Ms. Brooks is talking about, inquiries. Where is the stopgaps? Where are we having the problems that we can address most easily? And I don't know if there are any other comments from the House.
Thank you. Mr. Varghese, just to clarify your licensing report, you said that the backlog for reviewing license applications is now down to 30 days. Does that mean the timeline from application to issuing a new license is 30 days, or is that something different?
To review the applications within 30 days.
So what's the average timeline between application and issuance of a new license?
So that varies now. Again, Marina is here. I'll let her clean up any mess that I make. But so that depends on what's missing, right, at the time of the review. And one application is not the same as the next one because there could be a number of things missing, and they have to bring all the deficiencies or resolve those deficiencies to get licensed. So once the review is complete, the deficiency list is populated, and the applicant can see online what's deficient. And now now, again, they need to work to get that deficient information to us. And as soon as if the file is complete, Marina, correct me wrong, if the file is complete, we can license that person within 2 weeks.
Yes, that's correct. The goal for once the application is complete is to actually issue the license within 5 to 6 days. But as you've heard, we've been reviewing a lot of applications. So we've looked at our processes. We've tried to cut down on that, what we call quality assurance review. It's a final check before we issue the license, to see where we can streamline that process, and also mentioned all those RAs we're hiring, trying to get more resources to help with that process as well. So we just have a high volume right now, but the important thing is that we've been reviewing them so quickly now and getting back to people. They know what their deficiencies are. They can start working on them right away, get those documents into us, and ideally complete that file. But now we're getting all those documents in, right? It's kind of the snowball effect. So now we're getting all those documents in. That's our next stage. We're now caught up, or will be very soon in the next week or so, caught up on reviewing the new apps. The next stage is now focusing on all those documents that have come in, getting them reviewed, the final stage, right? And then getting them licensed. So that will be the next focus after probably this week and next week.
Thank you.
You're welcome.
Thank you, Dr. Hauser. Dr. Mahmood, followed by Mr. Watkins.
Yeah, thank you so much. So there has been quite a bit uncertainty, not necessarily uncertainty, this new pain management CME. So many physicians have reached out to me, and I'm pretty sure others too, that they don't know what exactly it is and how they get it, where they get it. But I think when somebody's license is up to renew, you are sending them a CME booklet from the boards to complete that. So is it possible to send that CME booklet to anybody whose license is due in next 1 year so people know what is going on? And number two part is, and who is making money on the CME? Why medical board cannot make money or take a share of that? Because I think medical board can make over $5 million out of that, and that's very kosher because they will have to pay somewhere else anyway. And we not put a restriction on them to take this one, but we are sending a booklet to do them a CME. And what is the cut and medical board on that? That can be helpful in a long way.
I think we'll discuss that, and then maybe staff will reach back with you and get more information on that. We can discuss further.
Okay, but sooner, because this is already in process and people are doing it. At least 10 physicians in the last 1 week have reached out to me. They have paid $150, the booklet you sent to do the CME.
Okay.
So this should not be delayed at all. I think should be done right away.
Dr. Mahmood. Mr. Watkins?
Yeah, I only have 2 questions. About the fund condition. You see, I noticed that we are not going to be in any substantially better position after receiving the increase, because we will be at 1.9 in 2 years and 1.5 and 1.1 before the small increase comes back into effect. And I'm curious as to when we manage the board on this margin, how does it affect the overall just performance?
Thank you for that question. One thing I did not elaborate is that this is the fund condition as we see it now, but the goal of my staff and me personally is to not only rely on this fee increase, but at the same time look ways to cut to waste or expenses that we don't need to spend, so decrease the expenditure, and at the same time increase our cash flow, right? And again, these are discussions that we are currently having at the staff level, how to do that. And cost recovery, for example, I mean, we just embarked on cost recovery and able to recover our cost. How are we doing that? Are we collecting our cost that's due to us on a timely basis? Or the cash flow, increase the cash flow? Are there ways to be more aggressive in collecting the money due to us, by going through collection process, So increasing cash flow, increasing revenue, and cutting the cost will also have an impact on the bottom line, the fund condition. Our goal is to get up to what is allowed by the new statute, up to 6 months in reserve, right? We cannot ever completely rely on continuously to ask for fee increase going forward. So we should be a lean and mean organization to carry on our mission going forward. We also need to be aware of that 80% of our cost is in enforcement, and which is an important part of it. That is driven by how many complaints we receive, the complexity of the complaints, and as I pointed out in my previous quarterly report, also in here too, there are enforcement costs or litigation costs that's beyond our control. I mean, these are not related to patient complaints. These are related to lawsuits filed against the board and the board members that we have to spend money to defend us in those civil lawsuits. Those are in the millions of dollars. So again, those are contingencies we need to be prepared for. But in the nutshell, I personally feel confident that if we have such enthusiasm in increasing our cash flow and revenue and cutting back on expenses where we don't need to spend money, we can, it'll take time. It'll be gradual build up, but it'll take time, but we can get up to our allowed 6 months reserve in the future.
Okay, thank you. Because I'm just looking at, effectiveness of the board, which has always been my concern, because effectiveness, if there's no money, suffers. Because we then have to look at ways to sidestep and not get involved in things and not pursue things. So my second question is actually it's a live question that showed up for me yesterday. And it was with regard to when a ALJ makes a stipulation, right, to an out-of-state doctor, and that, there's 15 conditions, and somewhere in the process, someone makes a decision that we're not going to comply with some of those conditions because it's an out-of-state. Who makes that decision?
So if a licensee is on probation and they're licensed here and they are in a state where they're not monitored, or
they are being monitored in the other state, but the criteria that on which they are monitored in that other state is like 5 criteria. And we've asked for 15 or 10, just like keep it simple. We've asked for 10, and then we do not receive documentation, I don't think, on what that looks like. We ask for 5 years, they do 2 years. We ask 10 conditions need to be filled, and they only fulfill 5. Because the reason why I'm asking, because so many of these conditions then fall away. And I want to understand who makes that decision if a stipulation can only be modified by a panel of board members, because that's pretty material when we say, okay, we are not going to apply this condition, or we're not going to apply this condition, so that this respondent can, serve out these probation in the other state.
I'm looking to Carrie to see if she can chime in because it's an enforcement.
Well, I mean, we can't talk about specific
No, it's
panel
not.
cases,
This is an example.
but an example of something that would be specific to someone practicing in California would be like patient notification for patients in California. That's not a requirement in the other state. So that's not something that they would follow when they're practicing in the other state. And that's, the probation monitors monitor compliance, or probation inspectors monitor compliance with the order of probation. And if there's a violation that where a petition to revoke is necessary, then they create the package to forward to the Attorney General's office.
So I understand all of that. The question I ask is more specifically, who makes that decision ultimately? Who decides This is a condition that will stay, and this is a condition that we will not pursue. Is that dependent upon the other state? If they don't ask for certain things in their order, as an example, and we ask for it, then basically what we are asking is because they are in their state. That means they are not really serving our conditions. They're only serving their conditions. You follow?
Yeah, I mean, I think it's very fact specific and, the probation inspectors are the first line. So if there's a specific concern that you have, we probably need to get more information.
I think I'll do that offline, yeah.
Thank you.
Thank you.
Are there other questions or comments from the members on the executive manager report? Yes, Dr. Blunt.
Yeah, I just wanted to follow up on one item, and that is going back to the license applications, and just wanted to know if you specifically have any information, how are we doing with our residents, fellows, because it will be coming back up. All of the people are going to be knowing that they're going to match soon some of the fellowships that are out of sync. And where are we with that? Have you heard anything from the field that there still may remain concerns?
Marina, I know the current physician training licensees who are received kind of a grace period into March 2024, they're all on track in getting reviewed. And the new match that do need a license, but they have like 180 days starting January 1, right? So, but we are receiving those applications, but they're coming in. But you may want to expand on that.
Yeah, just to expand a little bit, there's various deadlines with the residencies and licensing requirements. So those who need a license by December, we are on track to have all those applications reviewed. Now, I had mentioned before, if they have deficiencies, they need to get those documents in right away. If we have the documents, the goal is to have all of the documents we have reviewed before those deadlines, so that if it's complete, their license is being issued before the deadline. If it's not, we're informing them, okay, we couldn't accept this for, X reason. And again, that would be on them to remediate that deficiency. So we are aware of those deadlines. For the ones that either if they have a PTL and they're transitioning to physician surgeon's license, we know when their PTL expires, we're on track to have all those folks reviewed. But again, there's a lot of deficient applications out there. And so the goal is if we have the documents, we'll review it. We'll get it reviewed before your deadline, if we're aware of your deadline. But there might be some, and I think this might be some of the folks you're referring to, if they're coming from out of state, we may not know when their deadline is, which with the recent law change, they now have 180 days to get their license. So that will give them more time to apply and get those deficiencies resolved. We're hoping that really helps cut down on anyone having to postpone the start of their residency because they haven't been issued a license yet, but we don't know when their deadline is. So we're actually looking at updating, and we will be very soon updating our online applications to ask that question. So when they're applying for a physician surgeon's license from, maybe they're coming from out of state, we're going to ask them, when are you starting? Are you starting a California ACGME California accredited program? And if so, when's your start date? So now we can then start keeping track of those deadlines because we just don't know unless they tell us at this point.
Thank you.
You're welcome.
Thank you very much. So on the executive management report, any comments from the public in the room? Please come forward, introduce yourself.
Thank you so much. I just wanted to introduce myself. My name is Michael Luzak. I'm a recent appointee to the Osteopathic Medical Board of California. And I'm attending this board meeting today as kind of an orientation to be able to learn something about the board functioning. I attended the panel A meeting virtually yesterday. I found it very informative. So thank you. Thank you very much.
Welcome and thank you. Anyone else? WebEx?
Anyone wishing to make a public comment on this agenda item can use the raise hand feature or type something Q&A window and we'll get you called upon. If you're on a call-in only line, you can press *3 in order to raise your hand that way. First up here, we have Rosie Arthur's daughter. Rosie should be receiving that request.
Yes, I did. Okay, well, this was a long segment, and I actually have 3 things to comment on. The first one of which is when you're talking about bringing on new staff and getting them up to speed. And I can say this from over 3 decades of experience in information management, that there's a great intrusion of artificial intelligence in information management, including medical. We've got TikTok giving out medical advice, and you can't do enforcement against them. But it also affects how these wonderful electronic medical records are generated and what information is deleted. So if you have lab results that don't fit in with the general population, then they delete them from your file, and it's not in the interactive database so that a doctor can look at their dashboard and use that to assist them. And so when you're doing your enforcement, if you get so far as to actually looking at records, people need to be aware that what you're seeing is not the record. Then the second one was, also on the presentation here, you cannot see the names of the people who are speaking on the dais. So I don't know who it was who was talking about the pain management CME booklet, but I think this is an area where we can take the ongoing compliance efforts, starting with the 2012 CME requirement for pain management, and integrate them with the current guidelines and the spirit and what's missing, along with the DEA requirements as well. And now if you want to make money off of that, you might be able to do that. But in the end run, the thing that's important is that the spirit is of the intent to actually benefit the patient in the long run is what we should keep in mind. And so if you can figure out a course and actually make sure that they're being
30 seconds remain.
being taught how to prescribe, not how to avoid litigation, I think, we make a gigantic step. So that's something to look at, but it should integrate both your own ongoing requirements, the current guidelines, and the DEA. And when they're in conflict, look for ways to resolve that in the best interest of the patient. Thank you.
Thank you for your public comment. It's time, Dr. Hawkins, I don't see any additional requests in queue.
Great. Moving to agenda item 7, update from external stakeholders. Update from Department of Consumer Affairs, Ms. Gear. Welcome.
Good afternoon. Hello and good afternoon, President Hawkins, Vice President Lubiano, Executive Director Varghese, and members of the board. I'm Melissa Gear, Deputy Director for Board and Bureau Relations, and I appreciate the opportunity to provide the Department of Consumer Affairs update this afternoon. Before I get started, I would like to take a moment to congratulate Marina O'Connor on her recent appointment as the Assistant Deputy Director and welcome Angela Strother. We look forward to working with you both. I have several updates and reminders to share with you this afternoon, starting with on November 28th, Governor Newsom appointed Tamika Moss as Secretary of the Business Consumer Services and Housing Agency. Secretary Moss has been the founder and CEO of All Home since 2019 and previously served as the CEO of Hamilton Families from 2017 to 2019. Secretary Moss was Chief of Staff in the Oakland Mayor's Office from 2015 to 2017, Executive Director of Hope San Francisco and the San Francisco Mayor's Office from 2013 to 2015, and is the board president of the Nonprofit Housing Association of Northern California. We extend a warm welcome to Secretary Moss and look forward to working with her. Next, on November 7th, UMass consultant Christopher Veal provided a virtual training entitled DEI Dialogue for Leaders to 173 DCA managers, supervisors, and leaders. Veal's training covered psychological safety and how it affects these conversations, as well as interactive discussions about the challenges that leaders are facing. Participants were given a training survey, and the feedback was extremely positive. The DEI Steering Committee will hold its quarterly meeting on December 15th. The committee will review a draft DEI intranet webpage that is currently being developed, elect a 2024 chairperson and vice chairperson, and discuss DEI training as it remains a committee priority. Once operational, the DEI intranet page will provide all DCA employees information and resources, including DEI hiring principles, which will serve as a guide for those involved in the hiring process. The DEI Steering Committee would like to continue to learn about and showcase the DEI activities of DCA's boards and bureaus. If your board has DEI efforts to share, please send them to DCA Board and Bureau Relations. DCA continues to support DCA boards and bureaus in expanding culturally competent communications and promote the importance of meeting the needs of all California consumers, licensees, and applicants. The latest issue of DCA's Consumer Connection magazine includes articles with information important to consumers, including a feature cover story translated into 4 languages to further the reach of this information. The magazine is available on the DCA homepage. Printed copies of the magazine are also available. If you'd like copies, please email consumerconnection, one word, at dca.ca.gov. Also, on November 29th, the department successfully launched a new process and portal in support of service members and their families following new federal and state laws passed this year, known as the Federal Professional License Portability and State Registration Portal. This new DCA online portal will allow boards and bureaus to accept online requests from military service members and their spouses who currently hold a valid license in good standing in another state, district, or territory to register their practice in California within the same profession or vocation if they relocate to California because of military orders. This online portal will allow DCA to properly receive, track, and review requests to ensure compliance with federal and state law. In addition, DCA's military resources page and board and bureau licensing web pages have been updated with federal professional license portability and state registration information. It is vital that we provide service members and their families coming to California under military orders with the highest level of customer service and assistance. DCA continues to strongly encourage all boards and bureaus to streamline internal processes, use single points of contact for military licensure requests, and process all military requests as quickly as possible. Developed and implemented completely by DCA staff, this is a huge accomplishment. We are very proud of the talent and teamwork that made this portal a reality. In addition, as a reminder, DCA boards and bureaus may conduct entirely remote public meetings without notice locations accessible to the public through December 31st, so long as the public is able to participate in the meeting remotely. Commencing on January 1st, 2024, 4 meeting options will be available pursuant to the Bagley-Keene Open Meeting Act. Option 1 Traditional single location option. This is a meeting where the majority of members are gathered at one publicly noticed and accessible location. No members are participating remotely, and there is no requirement to allow for remote public participation. Option 2, traditional teleconference option. Board members are located at different publicly noticed and accessible locations, and they are connected via phone or WebEx. There is no requirement to allow for remote public participation. Option 3, new teleconference option. A majority of board members are gathered at one publicly noticed and accessible location. The extra board members above a majority can participate remotely from private, non-public sites, and the meeting must allow for remote public participation. And finally, option number 4, the new advisory body teleconference option. All members of an advisory body can participate remotely from private, non-public meeting sites. The meeting must have at least one publicly noticed and accessible location where at least one board or bureau staff member is present and where the public can participate in the meeting. Additionally, the meeting must allow for remote public access. DCA encourages boards to work closely with their board councils to ensure compliance with the Open Meeting Act. Any concerns or questions, please let us know. Furthermore, please keep the following reminders in mind as you begin to prepare to close out this year and look ahead to 2024. First, as we approach the end of the year, there are 2 DCA-wide mandatory trainings that if you haven't already completed, we ask that you do so immediately. This includes sexual harassment prevention training and information security awareness. All DCA employees and employees, including board and advisory council members, will need to complete the sexual harassment prevention training by December 31st, 2023. Additionally, board members with an assigned DCA email are required to complete the Information Security Awareness Fundamentals training. This training also addresses your role in protecting DCA data and information. Both the sexual harassment prevention training and information security awareness training are available in the department's learning management system. If board members need assistance accessing LMS or additional information about any of these trainings, please contact Board and Bureau Relations. This month is also a perfect time to make sure that you have completed all your required board member trainings and submitted your certificates of completion to your executive director and DCA at memberrelations@dca.ca.gov. Second, California's restricted states travel list has been eliminated and replaced with a new public awareness project that will consult with community leaders to promote California's values of acceptance and inclusion of the LGBTQ+ community across the country. Over the past year, several out-of-state trips requested by boards were not authorized because of the travel was to a state on the restricted travel list. Now, out-of-state travel to all states is permitted if the trip is critical to the functions and needs of the board. Out-of-state travel requests must still follow the established process for review and approval by DCA, agency, and the governor's office. For questions, please reach out to your executive director or board and bureau relations. Third, in partnership with the board members, DCA will continue its tradition of generosity and caring for our communities. This year's Our Promise Giving at Work campaign is underway and runs through December 31st. Leading our efforts this year are DCA's co-chairs Monica Vargas, Deputy Director of Communications, and Yvonne Durantes, Assistant Deputy Director of Board and Bureau Relations. This annual campaign gives state employees, including board members, an opportunity to support nonprofits through a one-time donation or payroll deduction. These contributions make a positive impact by providing vital resources to those experiencing poverty, homelessness, food insecurity, and offer support to causes such as veterans, animals, the environment, and more. We hope you will join the state's campaign and contribute to a nonprofit or nonprofits of your choice. For additional information on how to give by December 31st, please contact Yvonne Durantes. Finally, the annual California State Employees Food Drive started this month and runs through January 8th, 2024. In our effort to support families in need, DCA has distributed collection boxes at the following Sacramento area locations: HQ1, HQ2, Bar, CSLB, and Evergreen. Employees and board members can drop off non-perishable items in the boxes for DCA to donate to a local food bank. Collection boxes will be available through January 8th, 2024. For more information on how to make a difference as part of this year's food drive and other ways to participate, visit www.fooddrive.ca.gov. And lastly, in case you missed it, BBR sent out its 2023 fall newsletter, which was distributed to board presidents, vice presidents, and executive officers. The fall newsletter is also available online at the board member resources page on the DCA webpage. As I close, on behalf of myself and the BBR team, I would like to thank the board and the staff for their hard work and partnership over the past year. I look forward to 2024 and all the great work that lies ahead. Thank you for your continued service and for protecting the consumers of California. I appreciate your time this afternoon and welcome any questions from the board.
Thank you, Ms. Gear, Department of Consumer Affairs. Next, update from Health Quality Investigation Unit, Ms. Nichols and Whitley. Welcome.
Good afternoon. I am Chief Kathleen Nichols with the Division of Investigation, and also with me is Stephanie Whitley, Deputy Chief for the Division of Investigations, Health Quality Investigation Unit. It is our pleasure to provide the board an update on the Health Quality Investigation Unit, also known as HQIU. We continue to move forward with our plans to merge 3 HQIU offices with IU offices to reduce space in Cerritos, Concord, and San Diego. This will result in a cost savings to the board. As leases come up for renewal, we are looking at future projects to maximize cost savings. Currently, HQIU has 26 investigator vacancies, which is a 31% investigator vacancy rate. We currently have 21 candidates in background for hire, 4 of which are in the final psychological and medical portion and hope to have final clearances soon. We are continuing to screen new applications for each office on a repetitive 30-day cycle, so we can quickly fill the remaining vacancies. In addition, we continue to participate in career fairs and have 3 upcoming law enforcement hiring events taking place in December and January in Sacramento, Los Angeles, and San Jose.
In September, we held a statewide supervisor meeting, which included presentations from DCA's performance management and health and safety units. In addition, we conducted specific training for supervisors on case management with the emphasis on completing investigations thoroughly and as timely as possible. The training was well received by our supervisor, and it was truly great discussing goals and exploring ideas in person. In October, all the division's sworn staff completed a post-certified mandatory peace officer training regarding racial bias and identity profiling. In December, investigators will attend a post-certified search warrant training class. In addition, we are planning a statewide medical consultant meeting for January 2024. We continue to visit HQIU offices to meet with our investigators about their work experience and our goals of case aging and quality. We have discussed the Enforcement Monitors report, and HQIU is excited about the opportunity for increased communication and collaboration to improve enforcement outcomes. We have made progress on our pending workload and cases over a year old, as evidenced in our updated graph in board item 7B. We continue to hold regular meetings with board staff, in addition to sending an automated monthly report with case status updates. We look forward to our continued meetings with board staff, and this concludes our updates. We'd be happy to answer any questions if you have them.
Well, thank you very much, Ms. Gear, Nichols, and Whitley of these two updates. Are there questions or comments from the members? Yes, Mr. Watkins, followed by Ms. Lubiani.
I was curious about, your supervisor training and all the different, you are excited. How many DAGs are part of this training? This, because of the nature of these investigations, has such a strong legal foundation. And in the monitor's report, it indicated that, there's like a bottleneck between your HQIU and the Attorney General's office, and more collaboration is required. So I was just curious, when you do these new trainings with the supervisors that do these investigations, is there any legal DAGs coming in and also helping to, clear out some of the issues?
At this particular training that we did in September, there were not any members present from the Attorney General's office, but that's something in the future, we'd like to incorporate as we build these collaborative models. The medical consultant meeting that we are scheduled for January of 2024, we have invited a supervising Deputy Attorney General who is going to give a presentation to all medical consultants. So kind of incorporating them in that. And then we look forward to the future models of being able to have more communication with DAGs and our field offices, with our investigators, supervisors, and management team.
Oh, thank you. Oh, that sounds exciting.
Lubiana?
Thank you. Great to see you both. My question was to your point about the consolidation of the offices and how that results in savings. I didn't realize, I wasn't sure how we were tied into that.
Well, right now, those three offices house only HQIU staff, so the lease cost for that office is absorbed completely by HQIU, which is the money that we receive from the medical board to operate. So by incorporating the other DFI program, the IEU unit in, they're going to pay a portion of that rent for the space they're using. So what we're able to do is create hoteling workstations. So the investigators, they're out in the field, they can come back into the office, they can plug their laptops in, they can work in the office. And then that way, the IU program, they used to have an office in Lakewood. We're giving up that lease. So we're essentially moving them into Cerritos. Those two offices are merging, but the salary savings will be it'll be in the rent. It won't be salary savings, but it'll be cost savings on the rent. And that's how it'll work. So for each office we merge, the IU program will pay a percentage of the rent for the space they use in that office.
Got it. Great news. Thank you.
So for both updates, any comments from the public in the hearing room? WebEx?
Anyone wishing to make a public comment can raise their hand or use the Q&A window and just type anything in there. We'll call on you. If you're on a call-in only line, you can press *3 in order to raise your hand that way. I've got Rosie Arthur's daughter here. Rosie, I can't recall if I cleared you out last time or not. So if you would like to make a comment, please go ahead.
It's working now. Okay. Thank you very much. Well, Ms. Gear's comments at item 7A, that's right in the same thing that I was talking about when I was referring to the minutes. And of course, I did not have any way of knowing what she was going to be talking about because she provided no materials in advance. She gave a very long presentation with no materials, talks about access and inclusion and everything else. There's no way to keep track of it. I would please request that her presentation, which she obviously has prepared because she read it verbatim, be supplied for the minutes so that we can have them there. And please annotate it with the references to statutes where necessary. So like in the minutes on page 3-5, where they talk about the restricted travel list. Again, this did not give the information. Then what was withheld was the fact that it did not apply to your enforcement activities. It's a very important thing. So, and now it's been done away altogether. And the reason why that is the restrictive travel list was on its face not in compliance with the laws of California. So we need to annotate this to include the statute references, not just the A, but the B part, the whole statute where necessary. And in this case, everything she put there regarding access is totally missing. So and that would be frustration. And then in the meantime, since they've had this list and access by computer, telecommunicating is also traveling. So anything that has been affected by this bad and incomplete advice needs to be looked at again. Are there complaints that were not handled appropriately because there was some misunderstanding that because
30
somebody
seconds
didn't
remaining.
comply with your law, that you couldn't process a complaint involving an out-of-state physician or medical provider. Anyway, this was why I complained last time. And so we need the information, and it needs to be in advance when you're talking about things at this important and how they affect things. So thank you very much.
Thank you.
Thank you for your public comment. At this time, Dr. Hawkins, I see no additional requests in queue.
We're going to take a 30-minute lunch break before resuming with agenda item number 8. Board's been working since this morning. Thank you. We'll resume at 1:30 p.m. Thank you. Moving to agenda item 8, discussion and possible action on legislation herringbone. Again, regarding SB 815, our bill, I want to thank Governor Newsom, DCA leadership, the legislature, consumer advocates, and especially Med Board staff. We would not be here without them. Mr. Bone.
You're stealing some of my thunder, Mr. President. Thank you. Will apologize in advance for my voice. I'm getting over a cold. Thank you, Mr. President. Good afternoon, members. The legislature ended their work for the year in mid-September, and the governor finished signing and vetoing bills the month thereafter. Therefore, this is the time we customarily review those bills that the board took a position upon and the governor approved. The legislature is currently on their interim recess and will reconvene in early January. At this time, I will briefly go through each bill on the agenda under item 8, and then take questions and comments at the end on all the items. As I go, you will hear me say that each of these bills will be mentioned in our December newsletter. That's important because in the final issue of the newsletter each year, which we expect to publish next month, we include a brief description and a link to various bills and other legislative information for a number of bills that were tracked by the staff, including the ones that we're going to talk about in a moment. The first is, of course, SB 815, the board sunset bill. This has been discussed at some length throughout the year. And before I dive in, I want to kind of piggyback on Dr. Hawkins' thank yous and extend first a thanks to the board for their patience and perseverance over these last few years. We had a sunset review in 2021, a 2-year extension. We continued pursuit of our own legislative priorities in 2022, and then had another extremely busy and I think fruitful sunset review in 2023. I think evidence of that is if you review the 21 items that we've noted in the analysis that discuss the various provisions of SB 815, you will see that it includes many board-requested statutory changes that support our consumer protection mission. And I think it's something, frankly, for us to feel very good about, in my view. It required the support and the diligence of our board leadership, current and immediate past president, the executive team, and consumer advocates who spent many, many hours engaging with the legislature and the administration. Too many people to thank, but I'd be remiss if I didn't also acknowledge my personal appreciation to the DCA and agency leadership staff for their being a great resource and support to us throughout the process. The efforts of Senator Roth, who was the author of SB 815, the staff of the Senate and the Assembly Business and Professions Committees, and Assembly Member Mark Berman, the chair of the Assembly B&P Committee, were all vital in bringing so many of these board priorities to enactment now through SB 815. The complete list of proposed implementation items is in the analysis. I'll just highlight and summarize a few of the key ones. First, you'll see there's multiple communication items noted, including some upcoming newsletter articles. Some of the key enforcement proposals in the bill will require time during 2024 to implement, particularly the board's newly granted fee authority for petitioners and working to stand up a new unit to staff the complainant liaison duties and conduct complainant interviews prior to closing quality of care complaints. And then with licensing, our staff will be working with the Board of Psychology to transition the research psychoanalyst program next year, making website and form updates to reflect the various statute changes. And we've already begun initiating outreach efforts to residents and postgraduate training programs to help ensure that all those affected individuals, including our PTL and transition applicants, are aware of the law changes that are coming online next year. As mentioned by Mr. Varghese earlier in the day, Mr. Taylor Schick, who is the Chief Fiscal Officer for the Department of Consumer Affairs, he is here and is available to answer any questions the members may have about the process and potential options regarding future loans to support the board's contingent fund. Next is, and the rest of these will be more brief, is AB 470, which updates continuing medical education requirements to encourage physicians to pursue CME courses that improve the quality of physician-patient communication in a culturally and linguistically competent manner. This bill will be included in the upcoming newsletter, as mentioned earlier. AB 1070 allows a physician to supervise up to 8 physician assistants at one time who are performing home health evaluations as defined in the bill. This update in the law will be included in the newsletter, and we will update our frequently asked questions webpage, which we have one dedicated to physician assistant supervision, and that will address the circumstances discussed in the bill. Next is AB 1369, which exempts certain out-of-state physicians from licensure requirements, authorizing them to practice medicine in California via telehealth with a patient who has an immediately life-threatening condition without a license from the board. And we propose including this in our newsletter. Next is AB 1395, which requires the board to issue a license to applicants under the Licensed Physicians from Mexico pilot program, those who do not yet have a social security number or an individual tax identification number. The details are specified in the bill and the analysis. Licensing staff have already completed their work to implement this law, and it will be included in the upcoming newsletter edition. Moving on to AB 1646, it expands an existing board regulation to authorize a resident who is enrolled in an ACGME accredited out-of-state postgraduate training program to receive medical training in California, a guest rotation, as it's referred to, for up to 90 days without a license. Staff, again, will include in the newsletter, and we intend to inform ACGME of this law change. Next is AB 1707, protects California licensees from adverse licensing actions or losing their staff privileges in this state due to certain adverse actions taken in other states related to the provision of sensitive services. This is not expected to impact the board's enforcement program. Therefore, board will include it in the upcoming newsletter edition. AB 1731 exempts a healthcare practitioner from the requirement to check the cures database prior to prescribing or providing buprenorphine in the emergency department of a hospital. Staff propose to update our relevant cures related content on the board's website and include it in the next newsletter. Next is SB 345, a bill that is very similar to AB 1707, as I touched on a moment ago. Similar to that bill, this is not expected to impact the board's enforcement program, and staff intend to include it in the next newsletter. The final bill is SB 544, it was discussed earlier by Ms. Geer from the Department of Consumer Affairs. It establishes an optional pathway under the Bagley-Keene Open Meeting Act for state bodies to meet via teleconference or an online platform like WebEx. Executive staff will be assessing on an ongoing basis in conjunction with the board leadership whether the options under this law, will be suitable for the board's needs. If the board uses one of these new pathways, at a future board meeting or MAC meeting or another body of the board, the public participation options will continue to be included and discussed in the board meeting agendas for those meetings. And this will also be included in the next newsletter. Members, no action is necessarily required on this. We're happy to take direction from the board to make any changes or additions to the proposed implementation tasks. And with that, Mr. President, happy to answer any questions.
Thank you very much, Mr. Bone. And questions or comments from the members? Christina, thank you again. Okay. How about in the room? Any questions or comments from those in the hearing room? WebEx?
Anyone who would like to make a public comment, please go ahead and use the hand raising feature or the Q&A window and just type anything in there and we can call on you in the order that we see you. If you're on a call-in only line, you can use the *3 in order to put yourself in queue and raise your hand that way as well. First up here, we have Judith Gorsey. Judith, you should be receiving that prompt on your end momentarily. Afternoon, Judith. It looks like your line's open.
Okay, thank you. Good afternoon. Thank you, Board President and members of the board, for allowing comments. I am speaking about SB 815, and I'm targeting your programs for allowing doctors to be reinstated once they have lost or had their license suspended. We know that it takes a lot for a doctor to lose his license. And as you set these bars, I urge you to set them very high for the protection of Californians. I appreciate your work in accepting these laws. And I appreciate Senator Roth for proposing this legislation. Our daughter, Megan Espinosa, went to Dr. Carlos Chacon of Bonita in 2018 for an elective surgical procedure. It was his custom to let his nurse, a regular RN, choose the sedation to be used. The drugs that were administered to our daughter, our 36-year-old, 4'11", 104-pound daughter, sent her into respiratory and cardiac arrest. Even though her heart had stopped, he had the nurse bag her, but he advised staff not to call 911 for 3 hours. We know that he left the procedure room at his own surgical center in order to see 4 other patients and call 2 anesthesiologists, one who offered to come and intubate her because Dr. Chacon did not know how to intubate a patient. Meanwhile, her oxygen level dropped to 48 and he refused the help of the doctor who was going to intubate her. After his office closed, he allowed 911 to be called. By the time she was picked up and taken to the local hospital, all activity above her brainstem had ceased. So I think some doctors' behavior is so egregious, they should never be allowed to reapply for their license. He has not lost his license, although, and I do want to thank Deputy Attorney General Keith Shaw, who I believe on the board's behalf spoke at the preliminary hearing in October for Dr. Chacon, and his comments may have been instrumental in having the judge prevent Dr. Chacon from doing surgery. I want to point out that Dr. Chacon
30 seconds remain.
gave us a lifetime sentence of pain and sorrow. We cannot reapply for our daughter. He had a total lack and disregard for her care. So as you set the protocols for a doctor to be able to have their license reinstated, please set the bar very high. Thank you for allowing me to speak. Have a good afternoon.
Thank you.
Thank you for your public comment. Next up here we have Rosie Arthur's daughter. Rosie, you should receive that prompt there on your end. Looks like your line's open, Rosie.
Yes, thank you. And I want to express my sympathy for the last caller, having lost a child under different circumstances, but I understand where, no matter what interventions we have tried to do, when we see things that it's very clear there should have been an intervention and it's just not done, that people who have an opportunity to do something stand idly by. There's no words that can erase that. Yes, and this is where we need another moment of silence, because there's too many instances where these abhorrent events happen and people stand idly by and do nothing and let it happen. Then I'm sort of befuddled now after that. The other comment I was going to make originally was on the last issue, SB 544, with the access issues that have been ongoing. I mean, we've had access issues today in the presentation. I think every time we have met, no matter what format, what platform we used, going back years when it was just only by telephone, perhaps remotely, there's always something new each time, and it seems like chasing mercury or herding cats. And certainly we don't want to switch to anything without a trial run where we can't go back. And sometimes that happens whether we want it to happen or not. I don't know how many times you've had your systems update automatically without your advice or consent, only to find out, your program that you work hard on is suddenly gone and you can't get it back. Same thing happens with all of these issues that we're working on. But access is access, no matter what.
30 seconds remain.
No matter where you try to place it under DEI or whatever, there's still a mandate to provide access. And it's one of the few things that's mandated. There's no mandate to treat a person. There's no mandate to give them appropriate care. But there is at least a mandate for access, and we need to make sure that it's done in a way that is facilitated and appropriate.
Please conclude.
Thank you.
Thank you for your public comment. Next up here we have Maria Ibarra Navarrete. Should be receiving that prompt. Afternoon, Maria. If you're there, there we go.
I am Maria Ibarra Navarrete. I am from San Jose and a volunteer with Consumers Watchdog. In regard to the implementation task for communication to the public about the new consumer rights available to them, communication needs to be ramped up when it comes to communication to consumers. The communication you have proposed is the standard things that you always do that only those of us that follow the board will ever read. You need to use other platforms such as your social media to promote these new consumer rights to a required interview and a patient impact statement. It needs to be included in the initial letter you send the complainants describing the consumer complaint processes. It needs to be included in communication and outreach to consumers so that the public in general knows of these new rights, just as they know that they have the right to file a consumer complaint. Furthermore, for the enforcement. I would recommend that the board create a committee to oversee the implementation and rulemaking of the consumer priorities in SB 815, including the complaint liaison unit. I would also recommend that the committee includes an equal number of public board members, including 2 members of the public who were involved in the SB 815 legislative processes. We appreciate the interested parties' meetings and would like them to continue, but these new consumer rights are so important. I believe that they require a committee to oversee the implementation processes. We have a short timeline to work with implementing the patient impact statement. A committee overseeing this function will improve communications between the board and the public and will help get these functions in process and implement without delays. When it comes to the waiting time period for licensure reinstatement, I see that the board is allowed to alter 5-year waiting period to file the licensure reinstatement after surrender of revocations. We are requesting that you maintain the 5-year waiting period to file the licensure reinstatement for all death cases. I hope that this board will take our recommendations under serious consideration because these new consumer rights are important to the public. Many of us have fought so hard for these changes because we did not have the right to a required interview. This board failed me in 2022 when my brother's death complaint was closed with little communication, but a letter stating this board was
30
closed.
seconds remaining.
Thank you.
Thank you for your public comment. Next up here we have Tracy Dominguez. Tracy, you should be receiving that prompt there on your end. Afternoon, Tracy.
Hi, I'm Tracy Dominguez, and I'm from Bakersfield and a volunteer with Consumer Watchdog. All these new rights of complaints and families are important to the public, but they're especially important to me because I really needed the rights when I was fighting for my 2 death complaints. As hard as I tried, I could not get the board to consider my infant grandson's death complaint. I couldn't understand why babies do not have the right with this board and other regulatory boards in California. I am curious, if you ignore a complaint, do I still have the right to an interview? You technically had to close the complaint right. If they require an interview was available to me, I would have had the opportunity to fight for my grandson's complaint to be reviewed. I have one more complaint to file, and I will be watching to see and continue to be active, moving the board staff to review the death complaint. With my daughter's complaint, it did go to investigation. Had I had the patient impact statement available to me, I believe that I could have had convinced the board to continue with the original plan and proceed with the hearing before the administrative law judge. Instead, at the very last minute, they offered the doctor to surrender his license, and this board knew that he had been harming mothers and babies, personally linked to the death of mine for 32 years. Had I had the ability to provide the patient impact statement, I would not only have had the opportunity to make sure this board knew who my daughter was and why, was to understand the evidence of the Department of Public Health was confirming what I had been stated. Instead sent my daughter home to die with no assessment for her, not going to see her or going to the hospital or even placing a doctor diagnosis. I was the one team advocate who worked hard with the other mothers so that the rights that I was denied, the rights that my daughter and grandson were denied. A letter to these families will the investigate send them an email? These families have very little time to respond to you and to provide a statement. We need to be alerted. Families need
30
to
seconds
be
remaining.
need to give the guidance and type the information that they need to provide an impact statement. Thank you.
Thank you for your public comment. Next here we have Alka Ari. Alka, you should be receiving that prompt on your end.
Hello?
Afternoon, Alka. Yeah, it looks like your line's open. Please go ahead.
Okay, great. Thank you. I'm Alka Airy. I'm from San Francisco and a volunteer with Consumer Watchdog. I'd like to comment on implementation of SB 815. I'm especially interested in seeing the implementation of the required interview is established within the target timeframe. This is important to me because my sister's death complaint was closed at the central complaint unit with no investigation and no interview of me. I have dedicated my time to these meetings advocating for this issue in honor of my sister. I want other families to have the rights that I was denied. I also want to see meaningful and tangible efforts made to promote the patient impact statement. This will be the first consumer right to be implemented this January. I want the public to know they now have this right, just as they know they have the right to file a complaint. The required interview, the patient impact statement, and the complaint liaison unit need to be implemented flawlessly and within the required timeline. I believe the best way to manage this effort is to form an oversight committee that will oversee the implementation, planning, and outreach to the public. This committee should have equal representation of public board members and a member of the public appointed to the committee to ensure the public's input is included in the process. These new policies are so important to the public, and a committee overseeing the process will allow you to effectively implement these policy changes within the short timeline we have to accomplish this. The time that licensees should wait to file for license reinstatement if their license has been surrendered or revoked should remain at 5 years if the discipline is based on a patient death. There should be no reduction of time allowed if a death is involved. I am dedicated to seeing these policy changes made and within the estimated time frame. This is a matter important to me and to the public at large. Thank you.
Thank you for your public comment. Next up here, we have Michelle Montserrat Ramos. Michelle, you should be receiving that prompt.
Good afternoon. I am Michelle Montserrat Ramos, and I'm with Consumer Watchdog. The implementation of the new consumer rights included in SB 815 is very important to the public. The timeline must be followed closely so there is no delay in its implementation. Our initial concern is that there is no delay in implementing the required complainant interview. We understand that there will be a waiting period following the approval of the budget bill, but this board can take steps to prepare for the hiring of new staff now, so you're ready to begin the hiring process once your funding is approved. We anticipate that the required interviews will commence in late December of 2024. It is critical that the required interviews are not delayed. We want the public to understand that they have the opportunity to provide a patient impact statement once their complaint goes to investigation starting this January. We want to make sure that the board provides guidance to the public as to the information that should be provided in this statement. We anticipate that the board will schedule interested parties meetings to seek input from the public regarding procedures to collect and process patient impact statements, and also gain the public's input into the functions of the complaint liaison unit. We recommend that the board create a committee to oversee the implementation of the new consumer rights included in this bill. We want to see equal public board member representation on this committee, as well as a member of the public to represent the public's interests. The implementation of the required interview, the patient impact statement, and the complaint liaison unit will be more effective with the oversight that a committee will present, as well as the public representation on the board, which will reinforce the input that the board receives from the public. We need to take a different approach besides a page on the website and a couple of articles in the newsletters to inform the public of these changes. We need you to utilize your social media platforms starting now to inform the public of these new patients' rights policies, and continue to use your social media to keep the public informed throughout the process. You need to change your format letters and brochure to include the required interview and potential for a patient impact statement with an updated intro letter, and an updated your complaint is going to be investigated letter. The recommended oversight committee could also make recommendations on how to conduct outreach to the public. You will also need to make changes to the online complaint tracking system to include the notifications for a required interview and a patient impact statement to be included in the first phase of the online complaint tracking system. The fee for licensure reinstatement or the fee to file for early termination of
30 seconds remain.
should be the processing costs for the board, similar to cost recovery. If the revocation or surrender of a license relates to the death of the patient, then the board must require the wait time to file for reinstatement of a license to remain at 5 years with no decrease in time. This will aid in the reduction of repeat offenders. Again, these changes are important to the public, and we look forward to working with you as you begin to include these changes in the enforcement process. Thank you.
Thank you for your public comment. Next here we have Kim Turbin. Kim, you should be receiving that prompt on your end. Afternoon, Kim. It looks like your line's open.
Okay, can you hear me?
Yes, we can.
Okay. My name is Kimberly Turbin. I'm from Los Angeles, and I'm a volunteer with Consumer Watchdog. I was one of the few people on our team that did get my complaint investigated, and I did get a license surrendered just before my doctor died. Although I did get some form of accountability for the lifelong harm I experienced, many other women did not. This is why the required interview is so important. I have talked to so many of my fellow team members, and many of them describe what it felt like when they learned that their loved one's life and death did not matter and was not worthy of an investigation. Now, because of the efforts of so many of us, other families will now have the right to be interviewed before the complaint is closed and will have the opportunity to fight to keep the complaint open. This is important that we get this right. We realize that you have to hire staff and have asked for 6 months to do so, but you can start planning and taking care of all the documents now, so you can begin the hiring process as soon as the budget is approved. How are we going to be notified that we have the right to an interview before our complaints are closed? Will you send us a letter? Will the analyst send us an email? Will a notification be available on our upcoming online complaint tracking system? Will we be notified by all of the above? We have limited time to respond to a scheduled interview, so I want to make sure that we have enough time to respond and schedule the interview. Who will interview us? Will it be similar to the doctor's interview? Will an investigator and a medical consultant interview us? Can we bring a lawyer to our interview? We need outreach to the public to notify them that they have these new rights in the enforcement process. We need to start this process now. With the patient impact statement available to complaints starting in January, we need to start announcing this new patient right. I realize that you have a page where it lists the patient impact statement as a new legislative change, but you need to use all the tools you have available in the month of December to let Californians know that if they have a complaint that have been forwarded to the investigation, they should expect to be notified and asked to submit a patient impact statement. Finally, many people seem to believe that once a doctor surrenders his license or have their license revoked, that they didn't get their license back. We know this to not be true. We are asking that you maintain the default wait times for 5 years before a doctor can file and have their license reinstated. If their license was disciplined based on the death of a patient. Thank you.
Thank you for your public comment. This time, Dr. Hawkins, I don't see any additional requests.
Thank you very much. Moving to
Oh.
agenda 9. Sorry, you have someone?
One popped up real quick and disappeared again. If you'd like to make your public comment, you can raise your hand again real quick. There we go. Denise Johnson. Should be receiving that prompt on your end.
Denise Johnson. I'm from Tracy and a volunteer with Consumer Watchdog. Implementation of the required interview is very important to me because I didn't have the right to an interview when my son's death complaints were closed and no investigations were put and no input from me. In honor of my son, Richard, I pledge to follow through on the implementation of this consumer right in the enforcement process because it will give another mother the rights that I was denied. With this in mind, we want to be involved in the planning of the process for the required interview. We hope that you will have interested parties meetings, but we also would like to see an oversight committee formed that will oversee the implementation of the required interview, the patient impact statement, and the complaint liaison unit. We want equal representation of public board members on this committee, as well as a member of the public who will ensure that the public's input is put into the process, we understand that the first consumer right that will be available to the public will commence this January, and that the public impact statement. We want the public to be notified starting now of this important new policy, but we also want the board to give us some guidance regarding the type of information we should provide. This is our opportunity to make sure that our family members and the harm they endured is represented through the investigation process and when decisions are made regarding potential discipline. Education about the complaint liaison unit is critical, as well as the patient impact statement and the new required interview. We need to start now in conducting outreach to let Californians know that these new rights are available to them. In regards to the waiting time for a licensee to file for license reinstatement after a license has been surrendered or is revoked, we believe that the waiting time should remain at 5 years in cases where the patient died. I think that this is only fair that the maximum wait time should be required for death. I'm very excited to see how these new policies are planned and implemented. I know that I will be here every step of the way to make sure they are implemented and on schedule. The public has waited a long time for some rights in this enforcement process. I want to thank you, the board, for supporting SB 815. And
30
Senator,
seconds remain.
thank you.
Thank you for your public comment. One more here now from Christina Hildebrand. Christina, let me send you that request.
I have a quick question. Can I speak on anything on 815 or just the consumer rights piece?
Anything on 815 is fine.
Okay, great. Thank you. So my name is Christina Hildebrand. I am the president and founder of A Voice for Choice Advocacy. My request on SB 815 is that you make known to your physicians that AB 2098 from last year has been repealed. So that was the bill that would have specifically gone after doctors for giving misinformation or disinformation on the COVID-19 vaccine or COVID-19 treatments. I believe you did put out information on that, or if you didn't, maybe you, I know it was covered in the press a lot, but I would ask that you allow or you tell physicians that that part of the law is no longer valid and that it has been repealed. Thank you.
Thank you for public comment. At this time, Dr. Hawkins, no additional requests are in queue.
Well, thank you very much. Appreciate the recommendations of all the members of the public, particularly advocates. Moving to agenda item 9, discussion and possible action on new legislative proposal. Mr. Bone.
Thank you, Dr. Hawkins. Staff have 2 modest legislative proposals for the members' consideration today. The first is discussed in agenda item 9A. In short, this would add to specified mandatory reporting statutes those who are practicing in a postgraduate training environment or with one of the board's special permits. There are 3 existing statutes that we propose to amend. The first is BPC section 802.1, which requires certain licensees to report felony charges and felony and misdemeanor convictions to their licensing board. The next is section 802.5, which requires coroners to report to the appropriate board findings that a death may be the result of a healthcare provider's gross negligence or incompetence. And the third is section 805, which requires peer review bodies to report to the appropriate board that a licensee was subject to certain sanctions by that peer review body. The language in the proposed amendments are on pages 2 and 3 of the paper. With that, I'm happy to answer any questions, Mr. President.
Are there questions or comments from the members? Any comments from those in the room? WebEx.
Anyone like to make a public comment on the WebEx, please use the hand raising feature or the Q&A window. Just type something in there. We'll call you in the order we see it. First up here, we have Michelle Montserrat Ramos. Michelle, you should be receiving that prompt. There you go, Michelle. Looks like your line's open.
Good afternoon. I'm Michelle Montserrat Ramos, and I am with Consumer Watchdog. We are happy to see new legislative proposals, especially for BMP Section 805. But we were surprised to see that an 805 report notification was not included. In this past year, we have spent an abundance of time advocating for a notification listed on the physician profile when this board receives an 805 report for a physician that has lost hospital privileges for a never event, or in the case of a substance abusing physician who was found under the influence while practicing in a hospital. We came to an agreement that an 805 notification on the physician profile under the secondary status was a reasonable way to provide much needed information to the public. We agreed that if a hospital took a disciplinary action against a licensee, that this was serious enough to give some information to California families. We are not asking for peer review information. We are only asking for a notification on the physician profile that lists that an 805 report was received and the reason why, such as 805 report, loss of hospital privileges, 805 report never event, or 805 report unsubstantiated. As you have heard, we have had cases where repeat offender doctors have lost hospital privileges at multiple hospitals following patient deaths, yet no one had the right to know. I think we could agree that a loss of hospital privileges is serious enough that a basic notification on a physician profile to provide information to the public is needed. We are requesting that the 805 report notification be added to your legislative proposal. Thank you.
Thank you for your public comment. Up next here we have Rosie Arthur's daughter. Rosie, you should be receiving that prompt. Fortunately, my battery for the timer died, or the camera for the timer died, so I'll just continue to give the 30-second audible prompts. Thank you.
Okay.
Go ahead, Rosie.
All right. Do I get my full time?
Absolutely,
Okay.
yes, sir.
All right. Thank you. This legislation regarding the coroner's reports. Oh, that is really something, because I had to deal with a coroner who really didn't want to know what the cause of death was or any of the history. And matter of fact, they took bogus information from somebody at the Veterans Affair that had the wrong diagnosis down and basically attributed my son's death to certain things that were inaccurate. They were difficult. It was difficult to get a copy of the report. I had to work by writing and calling, and I finally had to go in person. And then I had to prove that I had been writing and calling them to get the information, only to find that they didn't do any testing that they should have done. They hadn't made any contacts that they should have made. And basically, some non-medical person read something inaccurately out of a record, and they used that to base their conclusions on. You will find that if you have this type of reporting and there's some way to enforce it, we'll start finding out about this horrible problem that exists out there before it comes to costing lives. My son had a diagnosis that wasn't in his record because the VA was going through some updating of their systems during COVID. So he didn't receive treatment for it either. And if he'd received treatment, he'd be alive today. Instead, he had no options. So the coroners, they're the last people in this whole chain. They should be reporting negligence
30 seconds remain.
And bad medicine when they see it come in, not just trying to push paper through an office and then hinder access to that information. If we have that information available, a lot can be learned, and some good can come from it. I don't look to just make negative comments. I want to find a positive path forward. This is one of the places where we need it, in addition to the 805 reporting. Yeah. Thank you very much.
Thank you for your public comment. Next up here, we have Alka Ari. Alka, you should be receiving that prompt on your end.
Great, I just did. Can you hear me?
We can, yeah. Please go ahead.
Okay, great. My name is Alka Ari. I'm from San Francisco and a volunteer with Consumer Watchdog. I was excited to see a legislative proposal that includes BP Code 805, but I was disappointed to see it did not include our recommendations that we discussed at board meetings and during Sunset Review. We came to a mutual agreement that there was a need to notify the public if you have received hospital disciplinary action reports or 805 reports. This isn't just vital information for the medical board, the public deserves to know as well. We are not asking for peer review information. We are only asking for the board to acknowledge receipt of an 805 report and the reason why. Loss of hospital privileges is a primary reason why this board would receive an 805 report. If a hospital has lost faith in a physician to a point they don't trust them to treat their patients, then that information is important enough to share with the public. We are merely asking for a notification on the secondary status of the physician profile that would list 805 report loss of hospital privileges or 805 report never event. The public should have a right to this information. Thank you.
Thank you for your public comment. Up next here is Maria Ibarra Navarrete. Sorry. You should be receiving that prompt on your end. There you go, Maria. Looks like your line's open.
Thank you. We have discussed, my name is Maria Ibarra Navarrete. I am from San Jose, a consumer with Watchdog. We have discussed the issues of Business Professional Code Section 805 for a number of meetings leading to the last Sunset Review. We have reached a point where you agreed with us that we needed to take further action on 805 reporting and how to inform the public when you receive an 805 report or hospital disciplinary action report. We are requesting that you include in your legislative proposal that you are required to post on the physician profile anytime you receive an 805 report for a physician. We are asking for a specific post, such as 805 reporting for loss of hospital privileges or 805 report never event of sentinel event. We are also recommending that you also post the 805 report unsubstantiated for those reports that you do not take action on. The notification that the board has received on 805 report must include the physician's profile and not hidden in the public document attachment to the physician profile. My brother suffered from a never event, which it appears was not reported, and this board chose to not investigate. A never event must be reported to this board, similar to the loss of hospital privileges. If this board is not receiving these reports, then a minimum, if the public is reporting it to you, then you need to investigate it further. We understand that there are some times where the hospital may not be reporting these hospital disciplinary actions to you. But we can't take the stance that it is not reported to us, therefore we will not take action on this either. As the board that oversees the licenses, it is your responsibility to work with other agencies that investigate hospitals that do not report, or at the minimum investigate our complaints that outline these disciplinary events which harm patients or, in the case of my brother, led to his death. Thank you.
Thank you for your public comment. Next up here, we have Tracy Dominguez. Tracy, you should be receiving that prompt.
Hello?
Good afternoon, Tracy. We can hear you. Please go ahead.
I am Tracy Dominguez, and I am from Bakersfield and a volunteer with Consumer Watchdog. We have discussed in BPM Section 805 this past year. We came to the agreement that the public should be notified if the board receives an 805 report or a hospital disciplinary action report. This is important to me because my daughter's doctor lost hospital privileges at 2 other hospitals in Bakersfield before she died. At the one hospital where he still had hospital privileges at the time. If 2 hospitals did not trust him to treat their patients, isn't that information that my daughter and my family should have the right to know? After Celeste Ortiz died at Adventist Health, he lost his privileges. He lost his privileges at a second hospital as well. We request that when you receive an 805 report that you require to post it under the secondary status on the physician's profile listed 805 report, lost of hospital privileges. We are asking to reveal the information in a report. We are just asking for notification that the doctor has lost hospital privileges. Had this been done, lives could have been saved. We agreed that it was needed. Please expand your legislation proposal to include posting notifications that the 805 report has been received for a doctor and the reason why. This will help surely monitor a license and save lives, and it will cut down on the request of repeat offenders issuing. Please, it would save my daughter and my grandson's life. Please listen to us. Thank you.
Thank you for your public comment. Next up here, we have Christina Hildebrand. Christina, you should be receiving that prompt.
Hi there, Christina Hildebrand from A Voice for Choice Advocacy. I was reading over the proposals and it's a little confusing because I don't believe the agenda items really match up with the materials, but I agree with the people that are from Consumer Watchdog that want to have the reporting done. What my question is currently you could do that. You could report who has an 805 or the other statutory pieces. You could do that on the website. You don't need a law to do that. My concern is the fact that you're bringing this forward, and I would, say to the people from Consumer Watchdog, go talk to a legislator to bring your bill forward, because I worry that the medical board is not doing this for the purposes that the public wants, but more for their own purposes. And maybe it's for budgetary reasons, but my perspective is currently there's nothing, and maybe there is, and maybe I don't know, but currently there's nothing stopping you from putting on the website on a physician's record those details. Thank you.
Thank you for your public comment. Next up is Kim Turbin. Kim, you should be receiving that prompt. Try again here, Kim. It looks like you lowered your hand. There we go.
Hello, my name is Kimberly Turbin. I'm from Los Angeles and I also volunteer at Consumer Watchdog. I would like an action included in section 802.5. We believe that you are not receiving reports from the coroner's office regarding deaths that may be a result of gross negligence because this information is not getting to the coroner's office. We are asking you to conduct more outreach to the coroner's office to make them aware of this requirement as well. Thank you.
Thank you for your public comment. Next up here, we have Denise Johnson. Denise should be receiving that prompt.
Yes, thank you. Again, my name is Denise Johnson. I'm from Tracy and a volunteer with Consumer Watchdog. I would like to see your legislative proposal for BPC Section 805 to include the issues we discussed prior to and during sunset review. The board had agreed in prior meetings that there should be some public notification if you receive an 805 or hospital disciplinary action report. We are asking for a notification on the physician profile under secondary status that an 805 report has been received and for what, whether it is for a loss of hospital privileges or a never event. If there's a lack of an action, then we want the notification to be listed as 805 report unsubstantiated. We believe that if a hospital takes a hospital disciplinary action against their licensee, it is important enough to notify the public, and it should be listed in the physician profile and not lost in a public document. Thank you.
Thank you for your public comment. Rosie Arthur-Sutter, you had already commented on this agenda item, so at this time, Dr. Hawkins, I don't see any additional requests in queue.
Thank you. Members, may I have a motion to approve staff's recommendation on 9A, proposed updates to Business Profession Code Section 802.1, 802.5, and 805 as presented? So President Lawson was the maker and the second was Dr. Mahmood? Yes. Mr. Taylor, may I please perform the roll call?
Dr. Bullock? Yes. Mr. Brooks?
Aye.
Dr. Helzer?
Yes.
Ms. Lawson?
Yes.
Ms. Lubiano?
Yes.
Dr. Mahmood?
Yes.
Dr. Sy?
Yes.
Mr. Watkins?
Yes.
Dr. Hawkins?
Yes.
Thank you, members. The next and final item I have for you today is Agenda Item 9B, which proposes to add a statute that requires posting online an order from the board that involves civil monetary penalties. Currently, these orders are public documents already, but the law does not authorize the board to post them online. Therefore, to obtain such an order, an individual must contact the board to request a copy. Compared to disciplinary orders, these civil order penalties are infrequently issued. In the prior fiscal year, as noted in the paper, the board issued 7 such orders and only 5 in the year before that. The background section provides some examples of the types of violations that may lead to one of these civil monetary penalties. Staff have not yet finalized the proposed language. Therefore, if the board is agreeable and approves this, then the staff will continue working on the language and submit it to the legislature for inclusion in a committee bill. This proposal, again, is simply aimed at increasing the transparency of these already publicly available orders. Happy to answer any questions, Mr. President.
Thank you. Are there questions or comments from the members? From the public in the room? WebEx.
Anyone wishing to make a public comment on this agenda item can do so by raising their hand or typing something in the Q&A window. If you're on a call-in only line, excuse me, if you're in a call-in only line, you can press *3 in order to raise your hand that way. First up here, we have Rosie Arthur-Sutter. Should be receiving that prompt.
Okay, actually, this is a hangover from the last one. The reason why I raised my hand again on the last question was to...
Ms. Arthur-Sutter, you have to speak now on the agenda item. So that's the proposal to post notification on the board website when civil penalties are issued. So if you have a comment on that, you may comment at this time. If it's for a past item, we've moved on.
Rosie, I've sent you the request to unmute. If you have a comment for 9B, we can take that now.
Okay. Historically, these reports have not been made going way back into the 90s. So we still have the same problem that we have ongoing, is that these reports are not being made for a number of reasons. How you're going to make the horse drink after you get them to the water, you know, is another issue, including the board neglecting to notice things like the bill regarding the coroner's reports has been in effect since 2013. So there's a reason why you're not getting reports. And this has been, whether it's from the courts, in this case or another, from the coroners, from the insurance companies, it's a broad-based issue that they are reluctant to make a report and have been for decades. So absolutely, we need it, and we need it available in real time when these things come in on California Breeze or however you can do it. We need to know that, because I've actually gone down to the courthouse to find these things, only to find that, you can't hardly find them. In this information age, we should be able to find this information out easily. In some places now, it costs you money to check court records. So, yeah, we need to have this accessible and timely. Thank you.
Thank you for your public comment. This time, Dr. Hawkins, I don't see any additional requests in queue.
Okay, members may have a motion to approve staff's recommendation on 9B as presented.
So moved.
Second.
President, I have a quick question.
Yes,
If I may.
Luana.
Aaron, for this one, looking forward, I think many of us would agree that these changes help with transparency about these fines and also efficiency, less, it's available for people to see. And so looking forward, assuming this goes through, how big is the lift to get it available to the public to see? Is this it would be online, right?
Yeah, I think the lift is relatively modest. We've been talking, of course, with Sean and ISB, and the amount of programming changes are pretty light. And then the volume, we provided a couple statistics on the last 2 complete fiscal years. There were 7 and 5 orders in total, compared to hundreds of orders that were posting, accusations and disciplinary orders and that sort of thing. So in that context, I think it's pretty modest.
Thank you.
You're welcome.
Ms. Taylor, please call the roll.
Dr. Bullock,
Aye.
Aye.
Dr. Helzer,
Yes.
Ms. Lawson,
Yes.
Ms. Lubiano,
Yes.
Dr. Mahmood,
Yes.
Dr. Sai,
Yes.
Mr. Watkins,
Yes.
Dr. Hawkins.
Yes, the motion passes.
That's it for me. Thank you, members.
Well, I want to thank everybody for giving their thoughtful considerations and recommendation to us. The board will now recess until tomorrow morning at 9 a.m.
There's a comment.
Oh, missed it.
No, I was.
Sorry about that.
Sorry. No. I wanted to indulge the board and ask if we could present, if you are open to receiving another proposal that I may have.
Process, Carrie or Reggie, process?
Is that something we can discuss during future agenda items or tomorrow?
Well, I thought this was, proposed new legislation.
It's not
I-
agendized, so it can be
Okay,
included in
I
future
can
agenda
put it-
items.
I can put it in writing as well. No worries.
Okay, thank you.
Thank you.
Did I miss anyone else? Thank you very much. See you 9 o'clock in the morning.